Namaste. This is Dr. Shwetha by tubal factor in infertility. So what are tubes basically? Fallopian tubes. So these are pipe-like structures which are present next to the uterus. This we call it as fallopian tube. In fact, in the fallopian tube, the egg and the sperm meet, form embryo, and this embryo comes and gets deposited in the uterus. Essentially, for a normal pregnancy to happen, there should be a proper intercourse, the uterus should be good, the tube should be open, and ovary should be producing good eggs. Now, how do we know that whether the tubes are open or not? In the scan, definitely we will not know whether the tubes are open or not unless and until there's a lot of disease that has set in, that we call it as hydrosalpinx. Unless and until hydrosalpinx set in, that is the end stage of the disease. Only then it can be picked up in the scan. What are the other ways of finding out? So routinely we do screening tests for tubal opening, that is HSG, that is hysterosalpingogram, which is done in a diagnostic center, which is basically an X-ray of the uterus. This is a little bit painful procedure. An alternate to HSG is SSG, that is sonosalpingogram. So what we do here is, we push a bit of fluid in the uterus and through scan we see whether the fluid is passing through the tube into the abdomen cavity, into the stomach basically. So this is relatively a painless procedure which is done to see whether the tubes are open or not. Suppose if the tubes are not open in any of these preliminary tests, we go ahead and do a laparoscopy. So laparoscopy is nothing but a keyhole surgery where we make small nick in the tummy, put camera inside and see whether the uterus is good or not, whether the tubes are appearing okay or if it is appearing diseased, or can a natural pregnancy happen, or if the tubes are blocked. So these are the findings that we are going to get when we are doing a laparoscopy. Suppose if there is a block in HSG and laparoscopy shows everything is fine, yes, she can go ahead and conceive normally. Suppose if there are tubal blocks that cannot be removed during laparoscopy, then these kind of scenarios leads to IVF. So tubal evaluation is a very important factor in couple who is trying to conceive.